Good morning, everyone.
Good morning.
Good morning.
Thank you for coming to Detroit Wayne Mental Health Authority's first retailer recognition. This is our first one. We're very excited about this. This is very important to us. I want to tell you the purpose why we're here today. In July 1992, Congress enacted the Alcohol, Drug Abuse, and Mental Health Administration's Reorganization Act, and that was Public Act 102-321, which includes an amendment, Section 1926, aimed at decreasing youth access to tobacco. This amendment was named after the sponsor, Congressman Mike Synar of Oklahoma. This requires the state enact and enforce laws prohibiting the sale or distribution of tobacco products to individuals under the age of 18. So you all have done a wonderful job. That's why we're here today. A lot of you are providers and some of you are retailers, and we want to thank you. My boss is going to go into more detail. What I want to tell you is that the states, all of the states, have to comply with this law, the Synar law, and basically, in order for us to draw down our block grant money. Our block grant money is what we use to pay for prevention and treatment and recovery services here in the state of Michigan. During the Synar Act, it was actually put in place because we saw a growing problem with children, basically having health problems due to tobacco use. Detroit Wayne must conduct annual Synar checks with all the retailers. We actually get a list from the state, and we have to go out and basically check to make sure that folks are not selling tobacco products to underage youth. Now, if we do not hit below 20% compliance, our block grant across the state will be cut by 40%. All of prevention programs are being funded by block grant money. So that means that would hurt us tremendously if we don't meet that target. I want to tell you that we met that target at 17%, and we're very proud. And for us to have as many retailers as we have in 43 cities, we did a very good job. Last year, we didn't do so well. We were at 32%. But this shows the outstanding job that all of our providers conducted, as well as all the retailers, by listening and helping us to meet this mission. So now I'm going to let you speak to our Chief Executive Officer and our President, Mr. Tom Watkins, and he's going to say some words to you all. Mr. Watkins.
Good morning, everybody.
Good morning.
And thanks for being here this morning. We're here today because we caught you doing something good. Doing the right thing for our community, for our children, and for the health of all of us. This is really important to me. I grew up in Maryland, Washington, D.C., and, I experimented with smoking as a kid. Pack of smokes back then, that was the old days, in the District of Columbia was 25 cents. In Maryland, because they had a little more taxes, was 35. And when I'd get a pack of smokes, 35 cents, you can get a Coke for 15, and my allowance was 50 cents back then. So I'd go in the store, buy a pack of cigarettes, 35 cents, a can of Coke, walk to the curb. I had at least 19 friends bumming cigarette off of me. And there was my allowance all gone. So that's what got me to quit smoking. I decided it wasn't a good economic issue for myself. But getting hooked on cigarettes is oftentimes a lifelong issue. It's not just oftentimes an experiment. Is that when people pick up that pack and they start, it's a long road. Hurts them economically. I mean, a pack of cigarettes today is what, $7? Brings about all kinds of health care issues, and the statistics are numbing on what it means to the health of the individual, secondhand smoke. But it's also personal, not only the beginning of my life, but the end of my mother's life. My mom smoked 2.5 packs of Camels non-filters for many years. And me and my 6 brothers and sisters used to ride around in that 53 Ford with that smoke coming. The year of 1953, my parents won that 53 Ford in a 50-cent raffle. My mom, many years later, passing away, and on her deathbed, the joke within the family was that one good thing happened that year, my birth or the car. And the joke was it was the car. It was the good thing that happened. And so my mom on her deathbed with a lot of smoking disease, literally pulling out the the oxygen going in, I asked her, "Ma, really, was it me, or was it a car, the good thing that happened?" She said, I said, "I think it was me, Mom." She goes, "If that makes you happy, honey." But what I witnessed, what happened to my mom, is the last years of her life were devastating. Unable to leave the house without tying a oxygen tank to her, the quality of her life, the pain of her grandchildren watching her slip away, even bending over and picking them up would put her out of breath. So it's personal. And so when we have great retailers, and when we went out and did this review with 96 retailers, and the overwhelming majority, when the undercover young person went in to buy a cigarette, and the retailer said, "No, we're not going to sell to you," you help stop a lifelong of pain and suffering, not only for that individual, but a lot of people that love them. And it's that important. In particular, within our community, is sometimes the retailers, if something bad happens at your place of business, it'll make the 6 o'clock or 11 o'clock news. And what we need to do in partnership with you is make sure that when you do the right thing, and the people within our community oftentimes do, that recognition is made as well. So the reason that we are doing this today, the reason we've been promoting it on social media and with our media community, is to make sure that everyone knows that when we partner together, when the Detroit Wayne Mental Health Authority partners together with the people that you see here, the agencies, Youth Connection, the Black Caucus Foundation, and others, and you retailers, good things can happen for our children, for our families, and our communities. So we're here today to applaud all of you for the work that you are doing. With that, I'm going to turn it back over to our Director of Substance Abuse, Ms. Darlene Owen, and I think she has some presentation of some plaques that she wants to make to people. Thank you very much.
Now I would like to present Dr. Grenade Dudley from the Youth Connection. She's going to speak about her experience as one of our DYTURs, and she's going to tell you everything that she went through. Thank you.
One thing I thought I could go in undercover, and my staff said, "No, Dudley, there's too much gray hair now," so I couldn't do it. But the Youth Connection is one of the organizations that is a partner and funded by the Detroit Wayne Mental Health Authority. And when we got the opportunity to work with the SINAR and to engage our kids in that process, the kids were just really excited. You know, they're going undercover. They wanted to wear masquerades and mustache and fake. I'm like, "No, sweetie, just go in as you are," kind of thing. And so it was a really interesting experience for them. Because one, they had to learn before they went in why we want them to do this, why it was not a real concern for them to be selling or for them to be buying or smoking cigarettes and those kinds of things. And we talked to them about that every day. Almost 3,500 kids between the ages of 12 and 17 years of age smoke their first cigarette. And there's an estimated 850 kids become daily cigarette smokers. This trend is going down, but we still needed to go to zero. And it's with the partnerships and the help of people in the community that we are able and we are going to do this. One of the stories we have to tell is one of our kids went into one of the retailers, and what they do, they look for, the loosies that are there. They also ask if they could buy a pack of cigarettes. And what we want the retailers to do is to say no and get out of my store kind of thing. Well, this one store says, "What are you doing in here? You know you shouldn't be smoking. Get out, get out." And we get back in the car and go, "Yes, finally, that's the way we want to do it." And if they did it with all the kids that walk in expecting, and at least to card them and to say, no, that is not the right thing to do. And it is about the partnership. The Youth Connection has a tremendous partnership with AFPD, and I know a couple of the representatives are here from there. That's the American Food and Petroleum Dealers. And they are committed to making sure that their retailers are in compliance. They are, self-regulating and making sure that we are all together doing the right thing. So it is my responsibility and my role to welcome you to the Youth Connection. I'm excited. Our kids are in school. That's where they should be, So I'm excited about that because they are all underage. And so we know this recognition is going to be the first of many, I hope, and that more and more will come in the future so that we can say, well done. Thank you.
Thank you, Dr. Dudley. Now I would like to introduce one of our retailers that we wanted to talk and hear his experience. And this is from Liquor Vault, and this is Mo. Thank you, sir.
Good morning, everyone. Good morning. I want to thank the Detroit Mental Health Authority for having us here. And I want to start off with saying, this is very important to me personally, because I think it's an ethical duty for us as retailers to be part of the community and to stop underage smoking, underage drinking, and so on. I have 7 children of my own, and I would never want any of my children, before they reach the age of 18 at least, to buy cigarettes. I would hope they never buy cigarettes ever, but at least till they're 18 to ever buy cigarettes. And same thing with alcohol till at least they're 21. But I think as a business owner, we got a responsibility to the community that we do business in to be community leaders, to abide by laws, and to make sure that we take, put 100% effort in being a leader in the community by making sure we support things like not selling to minors and doing different things to help the community and show our best face forward. I think that's the way we succeed in life and in business. I think those both are very important. And again, I want to thank everyone for being here and recognizing this. And I'm hoping one day that we can bring it down to zero. I think most retailers don't want to sell. I don't look at those guys that got busted as getting in trouble. I just think maybe they need to be educated more and to be brought up to light. And I think the majority of people are good. I don't think people intend to go out there and say, hey, I want to sell to a minor today. I think there's very few retailers out there. I think the majority out there are there to try to make a living and to do the right thing. Sometimes, yes, mistakes happen, but that's the thing we want to correct. We want to make sure that there's zero mistakes happening out there. And so my goal and my hope that we can have one day that we can have zero sales to minors, and we don't need to worry about that no more. And hopefully we can have, as smoking maybe one of these days, go away altogether. Thank you.
Now, Wayne County is very large. Again, it's 43 cities. So we have another DYTUR that's in Wayne County. Strategies to overcome obstacles and avoid recidivism. We call it SOAR. Ms. Valerie Bonner.
Good morning, everyone. Thank you. I really appreciate the opportunity to speak on this topic, primarily because I just lost an aunt on my birthday this year to throat cancer. And watching her go through that battle was extremely tough. And as I spoke with her about it, she looked so at peace. Every time I would go visit her, she would just always smile and be so at peace, but she was in a lot of pain. That disease is fairly undetectable. Initially, in the first few stages of it, you think you have a sore throat or something is going on, a histamine drip in the throat. Is not anything near what you would think it would be. When you get into about stage 3 or 4 is when they really can diagnose it. So by the time they diagnosed her and stopped thinking she had chronic sore throat or whatever, she was in stage 4. So I went to go visit her. And as we sat there, she loved Patti LaBelle and the Temptations. So she wasn't moving. She had lost so much weight. She was just sitting there. And so I looked on my phone and pulled up a Patti LaBelle song. And she said, hey, turn that up. So she sat up and she got excited. And I said, well, Auntie, while you're up, tell me about your experience. And she said, I lived how I wanted to live, and I'm going to die how I want to die. She said, but if I had it to do all over again, I would not have committed suicide, because I knew what these cigarettes could do to me, and I still didn't stop smoking them. So I just wanted to share that personal experience with you, because it's near and dear to my heart. Now, what I'm supposed to be talking about is SINAR. And as Darlene stated, there are 43 cities in Wayne County. And so 42 of them I'm responsible for. It's very, very challenging. I'm happy that we got the 17% rate, but it's very, very difficult because you have 42 police chiefs that know nothing about what we're doing. We have no support when it comes to that because they don't understand. They don't know what SINAR is. They don't know the impact of the failure rate, that we lose millions of dollars if we do not make the compliance rate. They don't understand. So I'm hoping with platforms such as this and additional awareness, perhaps we can even go to a chief's meeting. I don't even know if they have one. But I know that they don't understand, they're not aware, and they definitely don't know the impact of the non-compliance. So those are the challenges that I had. The rewards to work so diligently. I would like to thank Simone Calvis, she's not here. Lisa Horvath, she's not here. Corey Beckwith, they're not here. They're from the Guidance Center, Taylor Teen Center, and Access. They work effortlessly, so I stand here to represent all of us for the very hard work. Just those few people pulled this all together with the guidance of Cara and Darlene. You have no idea how much scrambling and work that it takes, and how much these ladies work effortlessly just this year to the last bewitching hour trying to make this happen. So I applaud them and all of their hard work as well. So I appreciate being here. Thank you for listening to me. I'm happy to have the role of the DYTUR, and I'm just soliciting support of everyone here to see if we can get the word out to the police chiefs in the other 42 cities and let them know what's going on and let them know the impact, because they don't know. Thank you.
Now I would like to take this time to introduce one of the best prevention services manager there is. Of course, she's ours, from Detroit Wayne Mental Health Authority. Her name is Cara Thomas. She's going to tell about our experience here at Detroit Wayne Mental Health Authority for bringing in such a huge job and doing a great job. So, Miss Cara Thomas.
Thank you, boss. That was really special. And I want to start off by saying thank you to all that are here. Whether you are mentioned, as you see on this big banner behind me, that there were so many people that have been instrumental in making sure that we made it through these 2 years. It's only been 2 years that we started doing SINAR in Detroit, Wayne County. So I'm going to talk to you about the process. You've heard about what SINAR is. Pretty much every year, it's just 1 month, 30 days, June 1st to June 30th, that we take, or we have a list that we receive from the state of Michigan. They select who they want out of our 2,200 retailers, and they give us a list of locations or stores to go to. And from that list, we give you our two DYTURs, I should say. Jeff is not in the room right now, but I must commend him and Dr. Dudley, who makes sure that I think she keeps a fire under his feet, going out there to educate first. The process, let me back up though, I just wanted to start off just saying it's not what you think it is, but it is an inspections of our retailers, and sometimes there's consequences that come out of it. And as she mentioned, how our rate was in our first year, we were getting to learn one another across this wonderful region, and so we were able to select Valerie and Jeff as those DYTURs. During that process, we were given a list that of the 2,200 we start off with, that's a master retailer list of stores that are across these 43 cities. We have to clean that list. That is the first thing we had to do. That was tremendous and an untiring, to say the least. It was a lot of work to do because we were still learning one another in this process in that first year. So, as we moved on through getting that list cleaned, after selecting our providers that, as you see here, that included SOAR, Taylor, the Guidance Center, Romulus, Black Caucus Foundation, and the Youth Connection. We actually had initially Piast on our list, who is here sitting up front as well, who was also part of the planning of this today's recognition. Piast had also secretly gone out to do their own education in Hamtramck. So I have to say that because you never know what is going on behind the scenes. When she brought me their list of stores, drugstores, pharmacies, who was selling tobacco. So must say thank you. You know, you'd be surprised how strong prevention goes above and beyond with those little dollars that we receive. But that's the passion behind what we do. Under their responsibility, we had some strict timelines to work with. We start off, after we clean the list, we do vendor education. We go out into the field and educate those retailers, making sure their signs are up and those birth date signs are up in the stores, and we have to, doing it to a certain time span that the state is required for us to follow. And we have to complete those. Then we even do some non-signer, where we got those 16 and 17-year-olds going out in the field and doing it during the out season, or not during the sign-hour period, as we call it. And after those, we make sure that we, those youth that are trained, those 16 and 17-year-olds know what they're going to deal with. We have to get those parental consents. It's a lot of work behind the process of making sure before we even hit the boots, hit the ground with the youth going out to do an official sign-our check in June. There's multiple forms that they have to do. Now this year was added for 2016, from 2015 to 2016, there was added the single cigarettes, the loosies on our forms. That was the new thing. Well, coming up in 2017, there will be hookah and e-cigarettes on the form for the youth to go out to ask if they see it, or if it has been offered, or if it's available. So each year, there is even more for us to do. So that adds even more stores for us to have on our retailers list and for us to be monitored. In 2015, we had 108 stores for sign-our. This year, it was 96 stores. And as you heard earlier, 78 out of those 96 sold last year. I don't remember the number of how many sold, but as you know, she said 32% into 108. I think you can get that figure of how many sold. So then there is, as during these compliance checks that we're doing in sign-our, those questionnaires are done. And they have to go along with a police officer, not always going in with them, but being that they are, have to be available if they're sold to. The fines are so low, unfortunately, when they do sell to our minors. There is a $50 fine. And we've been fighting, I think, the battle for so long when they are selling to our minors. In the FDA side, they have anywhere from the Federal Drug and you all know FDA is, as I'm Federal Drug Administration. They get a larger fine when they go out, and they go out year round. They also have taken our youth through our programs as well to go out in the field, the sites that they have selected, and they can be anywhere from $500 to $5,000 fines and multiple fines. So I don't want to make sure I noted that. Lastly, we do have, so much information, and I've heard even some of the reasons behind why some of us do this as a passion. I've heard some of your personal stories, and as I thought about what was to be covered today, to help us continue to reduce our tobacco use among youth, I was thinking about my own upbringing. Why is it so passionate to us to do this? Not just because I'm the prevention services manager, but because, I want to be able to breathe freely. You want to be able to catch your breath and say that I'm smoke-free. Now, I tried it in the 9th grade, too. I think we all have had to try the cigarettes, right? But unfortunately, I'm allergic to tobacco, so I like to kill myself, right? So, broke me all out. I'll never forget it. It was the worst experience that I would ever not want anyone else to go through. And not only because it was around us, took my daddy's more cigarettes, so I thought I was going to try something. That didn't work. But it's really, behind that is, why do we want to put some 3,000 chemicals in your system? Why, at anybody, no matter if you're a minor or if you're an adult, why would you want to pour as much of what comes out of that cigarette into your system? And I remember one of the stories my mother sharing, because she was a smoker too, as I've heard you say, but she just prayed that the taste would be taken away, of her doing that, and it went. So sometimes that works. I'm the faith-based person too, so I have to promote how things may work for you. But I do commend you all, and I thank you so much for just receiving, whatever it has to take on to do this. Not just the 30 days that SINAR comes out, but this is a year-round effort that we have to prepare and do no matter what, even if we are popping up on you to see. And even though I go in the store sometimes now, I'm like, where's the sign? Or are you selling, why are you buying this? Or the Lucy's or things like that. So I just wanted to share what our experience is, because I know many people wanted to come on board to help us with this, with the authority, but we had to get those that we know will be boots on the ground, and maybe it'll be your turn next time for the DYTUR. And so I thank you, and I thank you all who are here to keep continuing to spread the word. Let's give out some awards.
And as Kara stated, next year you have to be prepared, because e-cigarettes and also hookah are going to be one of the things that our youth are going to be looking for, so please do not sell it to them. Okay, now we'd like to take this time that we're all here to present awards, and we have a lot of them, and we're very proud. So we're going to start over to our left, Ms. Carr. Liquor Vault. Thank you. We'd like to take a picture. Carr, you got the camera so you can take a picture?
Sharon,
Hey, you're doing pretty good.
I'll say, shall I come around?
Come around, Nathan.
Come on.
Be like a
Why don't you come
Christmas
on
tree on the other side, that red and the green.
Why don't you come on the other side?
Get on the other side.
Teach me how to do this.
Yeah.
Take pictures.
Thank you.
Now, we
so
also,
much.
Thank you.
Thank you, young ladies.
we also want to make sure that you get, this is the fresh off the press, the sign that says what age or what the birthday has to be for tobacco and for alcohol.
Thank you.
And because you are one of our recognized retailers, this is a decal, is a window cling. You peel it off, put it in the window, and your store will be recognized as one of those stores. And I am excited about what it says. The Detroit Mental Health Authority and the State of Michigan Department of Community Health acknowledges that this business has been recognized as a Wayne County retailer who puts you first by not selling tobacco products to minors.
Thank you.
Thank you.
Thank you so much.
If I may, I know we had invited everyone on that list for whether they sold or not. And I do want to acknowledge that there is a retailer here who was very still passionate about the work that we're doing and received the invitation, but was one of the ones that sold. But we're going to give him, which is Mount Elliott Market. Am I right? Mount Elliott is in Market, Mario. That is here. So we wanted to make sure that I did let you all know he was present. And so he knows now what we want him to do next time around. Whether SINAR or non-SINAR, we will be visiting you.
All right, I think the rest of them, we will be taking them out next month, and we'll be going to all the different city council meetings and meeting the mayors, and we're going to be distributing them there and thanking them all for, doing a great job and being one of our partners. And we'd like to thank all of you. So please go back and have some refreshments, coffee, water, juice, what have you.
Can we just also acknowledge the organizations that are here that are up on the board? We have Empowerment Zone Coalition. She was a part of the planning process. We have a representative from LAHC, Miriam, is here. I failed to mention that we did do sign-our coverage this year. This was the first time I've ever done sign-our coverage. It's always happened down Wayne. And Marion and Jeff hit those booths. I was trying to follow and keep up with them out there on the street. Michigan Avenue in Dearborn was the selected location. The state chooses where we go, and they choose how many select sites we should do. And we did 36 this year. So I'm grateful for them coming on board to do that. Forgive me, PIAS Institute, as well as our Hamtramck Drug-Free Coalition. PIAS is here as well. We have Saw Youth Connection. Black Caucus Foundation of Michigan is represented. And I think,
That's it.
is that it? It's up here on the wall.
Valerie, you said SOAR,
Thank-
right?
I'm sorry, SOAR is here for strategies. We always get stuck on that. It's a tongue twister.
It
But
is.
thank you all.
It is.
We appreciate this time and for you all coming out as well. Please, fellowship.
Let's network.